Dr. Vijaybhasker, Chairman, Ethics Committee, Clinical Research and Trials, Masters in Orthopedics. The knee joint replacement surgery is okay or not in diabetic patients. Whether the diabetic patient can undergo joint replacement surgery or not is the question. Yes, there is no contraindication for the diabetes who need to undergo the surgery because when it is under control, it is obviously need to go surgery. Hence, the sugar level before, during and after the surgery need to be under control, whether it's within the tablets or the insulin therapy. Obviously, when we plan for a major surgical procedure, we need to keep the sugar levels under appropriate normal levels. We can maintain with the insulin, which is a direct effects on the pancreas, which maintain the sugar levels under control. So, before surgery, we should start the insulin with its lower doses. During the surgery, stress surgery, if the sugar levels increases, we need to increase the insulin dose, and even after surgery also, patient under the influence of stress and strain might require the insulin dose at least for 2 to 3 weeks. Once the sugar levels are well controlled, we can see the trial of tablets, oral tablets. If the sugar levels are controlled, we can withdraw the insulin therapy. So, dear friends, there is no contraindication for the knee joint surgery if the sugar levels are appropriate under control. Apart from that, we should see whether the urea creatinine levels of the blood normal or not. In diabetic, there is a possibility of effect on the kidneys leads to renal failure. So the urea creatinine levels in an appropriate level, like creatinine below 1, 1.2, and the urea below 32. If these levels are well maintained, even we dump extra medicines when do knee joint replacement surgery, then these kidneys might not lead to a complication. So obviously the liver function test, the kidney function test, and other general heart condition should be normal to do the surgery for the diabetics, because certain diabetics will develop silent angio pain, that is myocardial infarction, heart attack, that might affect the per-surgery, post-surgery problems. Henceforth, the diabetic people need to undergo a ECG, 2D echo, or further any necessary cardiac test to undergo a major surgery. So, friends, as such, the diabetic is not contraindicated for total knee replacement, but proper indication, proper care before the surgery is very important.